Fort Drum MEDDAC partners with local hospitals, and the U.S. Army Veterinary Corps prepares junior officers for service. This is the Regional Health Report. Welcome to the Regional Health Report for November. I'm Ann Krebs. Fort Drum, New York has been home of the 10th Mountain Division for more than 3 decades. The Fort Drum medical activity has provided medical care and services to soldiers and their families since the unit's inception. However, the Army Clinic cannot provide all the services, such as surgical care, to its patients. These needs are being met by local area civilian hospitals through a unique partnership.
The Fort Drum MEDDAC has been in a long-term partnership with area hospitals. These local hospitals provide services Guthrie Ambulatory Care Clinic cannot provide.
We have embedded military personnel, in leased government space working in Samaritan Medical Center, delivering babies, Carthage Area Hospital, performing orthopedic surgery, or, River Hospital where we do a intensive behavioral health outpatient program.
Since Guthrie does not have an operating room, Carthage is used to keep Army orthopedic surgeons ready and in practice.
That what happens when our ortho surgeons working at Carthage, kind of alone and unafraid in the hospital by themselves as the Fort Drum contingent, it replicates or simulates what it's like to be downrange in Iraq or Afghanistan as a battalion surgeon, as a brigade surgeon, when you don't have that preceptor, you don't have that senior, surgeon or staff to rely on. It's just you.
Military docs working on military members at civilian facilities benefits the surgeons and the facilities.
Having different physicians rotate in, mingle with our staff, they create best practices. So they bring best practices from the military to us, they observe our best practices, and together that synergy creates the best service for the patients. And then those doctors are able to take those newly learned skills to other bases and perform more complicated surgeries on soldiers as they continue their career in the Army.
We have worked closely with most of the local surgeons here, and we've had good collaborations with that. And we do get a breadth of exposure that allows us to go ahead and do what we need to do downrange, in addition to doing what we need to do here back in garrison.
The U.S. Army Veterinary Corps has a large mission. Not only do they take care of all military working animals, they also are responsible for protecting the water and food supply for our military members and their families. To prepare newly commissioned veterinary officers, the first-year graduate veterinary education program, also known as FYGVE, was developed to introduce and reinforce the skills necessary for them to be successful veterinarians and leaders. We visited the veterinary clinic on Fort Belvoir, Virginia, to learn more.
It became kind of a goal of the Vet Corps to establish an internship, a 1 year where they get mentored by both a public health preventive medicine officer and a veterinary clinical specialist, making sure that they are proficient in their knowledge, skills, and abilities for conducting the medical mission, both for our service members' pets and also the government-owned animals.
The first-year graduate veterinary education program exposes junior veterinary officers to all of the disciplines of veterinary services.
They spend, a week or 2 in the clinic, running sick calls, seeing urgent care, have a couple of treatment rooms with some technicians that are helping them run those rooms. They also get at least 2 days of surgery, 1 day of kind of elective surgery and another of surgeries that had been scheduled previously. And then they spend a week or 2 doing sanitary food audits, basic Army leadership, practicing some of the things that they're going to have to do once they go out to their first duty site.
It is not unusual to have just one Army veterinarian at a location. The FYGVE program prepares the new officers for these situations.
Definitely makes the program pretty good, because it used to be where you just leave vet school and go right into your first duty station. This is a good way to it's a soft landing, soft but hard landing into learning how to be a veterinary corps officer and a military veterinarian as a whole.
The more we learn, the better we can handle cases in the future when we're by ourselves and we don't have 4 or 5 other doctors to bounce ideas off of. So it's it's just great to like be able to figure things out, bounce ideas off someone before I'm just there trying to decide decisions by myself about these patients.
In other news around the region, Brigadier General Michael Place, the Commanding General of Regional Health Command Atlantic, recently visited Winn Army Community Hospital at Fort Stewart, Georgia. He took that opportunity to talk about maintaining soldier medical readiness through world-class health care and the hospital's transition to the Defense Health Agency.
The Army's purpose is to fight and win our nation's wars. That's what we exist for. So we need to be prepared to do that. That's what readiness really comes down to. For Army medicine, our role is to make sure that our forces are medically ready to deploy, fight, and win anywhere in the world, in austere environments, in harsh environments. The other aspect of readiness is to make sure we have a ready medical force to be able to have doctors and nurses and technicians of all different kinds to deploy to save lives on future battlefields.
Serving our beneficiaries at our military treatment facilities is one of the ways the medical force maintains readiness. Brigadier General Place also discussed the military health system transition, the creation of an integrated healthcare system, and the effects on care.
A more integrated healthcare delivery system is going to save costs through efficiencies. And it's going to standardize the experience that patients have. So the quality that you receive is because we've standardized our processes. And so now we're talking about doing that to the entire military healthcare system. We are your brothers and sisters in arms. We know what you go through. We understand the challenges, and we're here to take care of you.
Beneficiaries and staff at Blanchfield Army Community Hospital on Fort Campbell, Kentucky is offering an American Sign Language class for its staff and beneficiaries. Maria Yeager brings us the details.
Beneficiaries and staff at Blanchfield Army Community Hospital can learn and practice American Sign Language during a free group that meets twice a month at the hospital.
We started an initiative to improve communication between our deaf, hard of hearing patients. And so we are offering mini sessions to learn American Sign Language. We initially started it to get our staff comfortable with communicating with our deaf and hard of hearing patients and staff here at Blanchfield Army Community Hospital, but we would love the opportunity for our patients to join us as well.
An interpreter certified in healthcare interpreting is required by law for patients who are deaf or hard of hearing. Bach uses an outside provider when those services are required, but Fitzwater said introducing staff to ASL and deaf culture can serve as a bridge.
What we're doing here is we're teaching just the basics communication. We want our staff to be comfortable speaking with patients who are deaf and hard of hearing, and to be able to say hi, tell them their name, nice to meet you, welcome to our facility, and that they're going to go get the VRI so they can get the video interpreting. The staff love it. It's very nice to see things click when you teach it to them. They get excited, they're happy to learn, they're eager to learn. We have been asked to increase class times. I'm just so proud to be able to offer this to them, just to be able to make them a little bit more comfortable and aware of our patient load here as well as deaf culture.
That's the Regional Health Report. Join us next month for another show highlighting health and readiness across the region. In the meantime, don't forget to check us out on your favorite social media sites and on iTunes. Thanks for joining us.